Thank you, Mr. President. You know, as I sit and listen to my esteemed colleague from Virginia, I can't agree more. Now's the time really for us to come together to do what the Senate traditionally does best, and that is working on the best interests of the people across this country who are struggling right now. Compromise, it is not a bad word. It is time for us to get in a room and really do the job that the American public expects us to do, and that is looking out for their best interests at a time when we have a healthcare pandemic. Now, keep in mind, this is a once-in-a-lifetime pandemic, once in a lifetime. So that requires us to come together and really focus on how we help Americans across this country who are struggling right now. They shouldn't be penalized. We've asked them to stay home and shelter in place because we are trying to address how we do the research that's necessary for a vaccine. Hopefully one day we have that vaccine. How we ramp up the testing that is needed so everybody can feel safe and comfortable knowing whether they have this virus or not, or the antibody. But we're not there yet because more work needs to be done, particularly by this Congress. But the American public has heard us. And they're sheltering in place, they're staying home, they've shuttered their businesses, and now more than ever, this country needs the Senate to act. The House has done its job 2 months ago. They worked a comprehensive package. And I say comprehensive because we can't just pick and choose winners and losers here. This isn't what this is about. This is about making sure we're bringing relief and helping those across this country, and everybody is impacted because we've promised them, if you do what we say and we help stem the spread of this virus, we're gonna have your backs. We're gonna take care of you. But I will say that we have failed at that. This administration has failed. We have failed at that promise. And I know when we all go to our offices or we go home to our states, we are hearing from our constituents. We get emails, we get calls, we get letters. I know you all feel the same as I do. And we read them and we listen to them. And I don't know of one state in this country right now that somebody's not suffering from this pandemic that needs our help. And I know that's why I'm here. Because we have all took the oath. We've said we're going to be here working on best interests of our states and this country to make sure that those individuals across this country who pay our salaries, those taxpayers, expect us to do our jobs and work. And that's what I'm asking for right now. You know, I've been to the floor of the Senate this week to talk about the struggles that I see in my state. We all get letters, and I do want to focus today on one of them. There's so many, and that's why a comprehensive package is necessary. But right now, I would love to talk to you about what I am seeing, Mr. President, in my home state when it comes to our seniors and those who are in need right now of funding to help nursing homes. And let me just start with letters, because I think this is how it starts with all of us. Calls into our office, letters coming from our constituents. And there's 2 calls that I received. And one of them was from a daughter who called in for her father, who is in a VA nursing home in Boulder City, Nevada. And because he isn't showing symptoms, he isn't getting tested. With so many cases there, how is this possible? Where are the tests? This is a daughter who's concerned for her father, knowing that if we just get people tested, there is that comfort in knowing whether or not you have this virus and whether you should be quarantined or how we protect you, particularly those in nursing homes. And then another call I've received is a mother. She's also a certified nursing assistant at a nursing home, and she is telling me that many there quit because they don't have the proper PPE. They want to work, but they don't want to expose themselves. So what are we doing right now to address all of these needs? And listen, there's so much. It's overwhelming. I know it. But that's why we were sent here, for the hard decisions, not the easy ones, to make sure we're all working for the best interests of the people in our states. And I know you all feel the same way. But I have to tell you this, there are thousands of Nevadans that know the anxiety that comes because there's a spouse, a parent, or a grandparent in a nursing home unable to visit with or hug their loved ones for fear of giving COVID-19. You have seen it, you have heard it, I have heard it. Too many loved ones have lost their loved ones because of this virus, and they were not able to be there. You know who was there with them in the nursing home? Those incredible heroes on the front lines who are sacrificing their own health to be with them for those who pass away because of COVID-19. There are so many factors that raise the coronavirus risk for nursing home residents. The majority of residents we all know are seniors. Many have underlying conditions, they live in close quarters, and they share common spaces. And we also know this, residents and staff of these facilities shouldn't be an afterthought. They are a core part of our communities and our healthcare system. They are our elders and they are the keepers of our stories. We have to do more to protect them. And we need to protect the workers in these homes too, many of whom belong to communities of color and who are struggling to provide care to a population with unique needs. And the reason why I bring this up is because there is legislation out there to do just what I'm talking about and what we need in our communities. It's not something new. It's already been introduced. My colleague, Bob Casey, introduced the Nursing Home COVID-19 Protection Prevention Act to get nursing and long care facilities in Nevada and across this country more PPE, the testing that they need, and the staffing, and to help the staff and those that are in those communities. These homes need support to slow the spread of the virus and to respond rapidly when it does crop up, using all we've learned from combating this virus so far. The bill funds teams of nurses and other critical staff to lend emergency help at nursing homes with outbreaks and to bring the best practices to bear in helping sick residents. This bill ensures folks in my home state and across the country are being taken care of, that families have peace of mind that there is accountability for providers and protections in place for workers. I'm hearing from family members and loved ones of those in nursing homes in my state. I'm hearing from caregivers and healthcare workers. I know all of you are as well. And one thing that comes from all these people is a feeling of being forgotten. No one, Mr. President, in America should feel forgotten right now. It's time for us to come together. We need to make sure nursing homes follow guidelines, and that if they fail to do so, they will be held accountable. But we also must arm them with the tools they need to face a virus that's been relentless in attacking seniors. We should make sure that the next coronavirus package that we should be negotiating and working on right now does everything it can to support the most fragile in our communities, because they are also some of our most precious.